Hi, my name's Tom Durley and I'm the Executive Officer in the Undergraduate Primary Care Education team. As the COVID-19 pandemic unfolded in early March, it became clear that our medical students could form a key role in providing support to our local communities. Students from across the MBBS years came forward to be part of the scheme, volunteering their services to practices across North West London. I spoke to some of the GPs, link workers and students who were part of the scheme to discuss their experiences.
We had a programmed approach using a template on our clinical system, which guided people to ask the key questions about whether the patients had understood their status. They were asked to stay indoors for 12 weeks, if we remember at the time. They were asked to take especially stringent social distancing measures within their own home. And what this meant was relations within a family changed, the ability to do your shopping and get essential supplies was all challenged.
I think some of the really interesting experiences from this were just talking to some of the patients and just finding out what their kind of lives, how their lives had completely been thrown into complete upheaval, like a few cancer patients who weren't able to go into the hospital anymore for their chemotherapy and things like that, people who'd had to seclude themselves up in the middle of the countryside just to have a break from London life and trying to avoid the higher risk that they had to get COVID.
We worked with our clinical director to kind of set up a little service in place that reached out to our patients over the age of 70, partnering up with local faith groups and football clubs to offer befriending, shopping and medication collection.
They weren't just kind of doing that welfare check, they were trying to pick up on other issues as well. And remember particularly one case with Hattie. She spoke to a lady in her 80s who needed help with cleaning. And she didn't just hand that back to us, she researched some local cleaning agencies and contacted social services and did, really went above and beyond. So it really helped us at a time when we were really stretched.
A feature of this programme is the one-to-one interaction between a volunteer or staff member and the patient, people who aren't used to that kind of one-to-one interaction as perhaps we've become used as a GP. And with the training we've had for that.
When I first started, I found it a little bit daunting because I'm only in second year, so I've not had really any clinical experiences so far. And I think the nature of this sort of experience is quite intimate because it is just you and the patient over the phone. But I think from a personal sort of viewpoint, I have learned so much because I did feel sort of thrown in at the deep end. But I think the reason that was okay as well is because I had a lot of support and I could go to the doctors in the surgery or Dr. Wingfield if I did have any questions. And I think it was really valuable sort of volunteering now because it really did highlight how every patient phone call was different and everyone was coping so differently. And there were some people who were coping fine because they had such good support networks, and there were those who had no support, didn't know of the support that was available. So it was really rewarding to know that I was sort of helping to improve people's lives and hopefully lowering their chances of contracting the virus.
A lot of the conversations as well were really valuable in the sense that even though some of them are quite challenging and uncomfortable and emotional, it's actually really valuable for both the patient and for myself, like to have those conversations and talk it through and just, even if you didn't actually end up helping them and they didn't use any of the resources that you gave them, but they had that 20 minutes where they could offload a lot of feelings and vulnerability that they had. It allowed you not just to see like the healthcare patient relationship, but actually just as like human beings, just talking to each other. We're all going through this pandemic and it's been a really difficult time for everyone. And I think the most valuable thing was just being able to speak to someone, I think.
I had a patient who was over 90, living on his own in a 4-story house. I only know all of this because Hattie was able to get all of that from a conversation, from a welfare call from him. And we were discussing this patient because he needed some extra support registering as shielded. But Hattie had numerous calls to him by then, and she knew almost all the details of his life, and they had such a great relationship in literally the span of a few days. And that was just really lovely to see, because when I did also contact the patient again, he just had great things to say about Hattie, and he really appreciated the time she took to speak with him. So yeah, they really did make an impact where they could, which was great to see.
As part of their normal clinical placement, sometimes we get the feedback that patients almost find their experience of speaking to the students is particularly positive because the students have more time for them. Do you think that was kind of a bit of a factor there?
I think that is just right. And actually, I did have one conversation with Hattie, and she had phoned to say that she felt bad that she wasn't getting through the list quicker, because she was phoning people up, and she said some conversations were taking half an hour, 40 minutes, and she was almost apologetic. And I said, no, this is really valuable work. We had, in the period from kind of mid-March to mid to end of May, we spoke to or got in touch with nearly 3,000 older people in South Fulham, and she made a big dent in that list, but had some really valuable conversations, and we were so pleased that she had the time to, really have those chats with people. And the feedback we've had from patients has been fantastic, and from the GP surgery staff as well. She's been ever so helpful.
It's been super, super helpful having the students here. And I don't know, Ollie and Sam might be able to say whether they feel like some of the tasks seem like they're trivial, but in all honesty, they've been so helpful, like liaising with the pharmacists or calling up a patient or looking up resources for somebody. Like, it saved me hours of work.
So yeah, I've got to be honest, when I first volunteered, well, prior to volunteering, my expectation was that I'd be, sat on the phone, sitting at the reception desk, manning the reception desk. But it has been more than that. It hasn't just been sitting at a desk all day. Like Yasmin and Bhakti have said, we've learned about how primary care works. Quite a lot of what Sam and I have been doing is we've been working with doctors and healthcare professionals also to redevelop the annual asthma review process to accommodate the remote assessment of patients during a pandemic. So, we've been auditing, we've been sitting in on meetings, we've even been kind of informing the process as well and offering our recommendations. So up until now, my fear going into clinical placements was that I'd be a spare part. I wouldn't feel like I was part of a team. But you're right, this has given me confidence and, showing me that I can have a meaningful impact and be a meaningful member of that team.
They've managed to work out how to process map and think about how to, like Ollie was saying, redesign a system, considering all the constraints that we've had, and coming with fresh ideas and suggestions, and being able to implement those changes and be, it doesn't matter if they're 19 or 20, they're really much, they're really respected as part of our team. This is an example of what's come from this. So this is the asthma work that we're doing. So because we're also running training for the GPs in North West London, they've been helping me type up the questions and answers from there and help upload them to the national platform. So the asthma training has, which we did with Imperial, has now become the key training which has been shared nationally on the Health Education England COVID platform.
This whole time period has kind of just shown, it's kind of made us all get out of our comfort zone in a lot of ways. Doing telephone consultations is something that I think we're not really exposed to and we're not really used to before. But I think one of the benefits of volunteering within this program has simple things like it's made definitely me, but I'm sure it's made Lara and Georgia more comfortable using the system that the GPs use. It's made us more comfortable using kind of the software and being just better at phone calls and improving your ability to gain information via telephone consultations, which is something that we'll definitely need during our GP placements, but also in the future. So I think that's something to also bear in mind, because when we can't see a patient sometimes during our GP placements, we just don't see anyone if there's no one coming in. But I think now we can also see that in the future, if a patient can't come in, you can just do a telephone consultation with them and gain the same information. Minus doing the actual examination, you still have the ability to now talk to them and get a good history.
With the placements, knowing that we can learn quite a lot of information remotely will just hopefully make our placements more valuable in the time that we spend there, and actually can expand on the information we've already learned remotely.
I think they've become much more confident, and I think both of them seem much more willing to approach and come and ask questions proactively.
It's just brought almost light to the team, and we're really lucky to have them. And we have also felt that, I wonder, and I don't know if Ollie feels this at all, but I wonder if they're getting more training than we would normally give as tutors, because normally we do a lot of clinical training, but they're seeing the proper behind the scenes working on primary care. They'll never get to see that unless they're actually doing it as partners. They wouldn't get to see any of that, but I wonder if we're giving them also a better insight.
The feedback has been excellent, absolutely excellent. I haven't read a negative comment at all. So absolutely brilliant work. Thank you so much.
As a result of that, we've linked up just around 270 older people with local support, and some, a good chunk of those people are having longer term regular support now from our volunteers with befriending phone calls and help with shopping and picking up medication that they wouldn't necessarily have got. So, it's been fantastic that they've been able to help us identify issues that we just wouldn't have done if we'd not been making these calls. So, it's one kind of positive thing that's for us that's come out of the pandemic, is that we've got to know our patient population so much better in a really short space of time, and have been able to get them the support that they need, that they potentially needed pre-COVID, but we didn't know.
You can see that it was a real priority for them. And the patients that they did support, I feel like they stayed with them a little bit. It wasn't just something they left behind, and that was really, really lovely to see, because that's what we want, don't we? It's a people-facing, caring organisation, and you can really see that was at the heart of what our students thought and wanted to do as well and give back to.